As the virus tears through the cities of South Africa, the residents of one community are trying to rescue themselves. Welcome to Lenasia, on the outskirts of Johannesburg, where inhabitants have given up on the government. Self-preservation has been taken in-house as thousands of people fall ill. Akila Nosaka is a single mother who recently tested positive for COVID-19.
When I be giving you a little bit of oxygen right before you take you to hospital.
Her chest is aching and her mind is racing, but she doesn't want to stay in an overcrowded hospital.
Do you think you will have to go to hospital?
No, because I've got my kids at home and I mean, they need me and I need to get better.
Yeah, but let's change the filters. The filters need to be changed for COVID patients.
That's the head of the community ambulance service, Abu Bakr Saeed, and he's done something remarkable from his office at the local mosque. He's built a parallel healthcare system to treat people like Akila at home.
I must be honest with you, the government hasn't been doing much at all. We can't be sitting back and waiting for the government to do something because it will never happen. So that's why we needed to be out there making a difference.
Together with partner organizations, Mr. Saeed is hurriedly securing advanced oxygen machines, which turn ordinary bedrooms into critical care beds.
We have over 60 units available for the community.
You've essentially created 60 hospital rooms.
Absolutely, that's what it is.
Critical care rooms in this community.
Yeah. So by having 60 of these is exactly what we did. We can provide for 60 people at a time and try and make a difference to 60 lives. It's not just the one life.
That's your phone.
Sorry. Anaesthetist, assalamu alaikum.
It is an extraordinary concept, but home-based intensive care requires specialist doctors to oversee it, and sisters Fatima and Sophia Lambert are part of the team. We found them donning biohazard gear on the grassy verge of Nightingale Street.
We as South African doctors are very, very used to improvising. This is what we need to do, and we improvise.
We followed them into the home of resident Mohammed Saluji, who has been fighting for his life for the past 4 weeks. His oxygen levels were worryingly low, and he'd been coughing up blood in the early hours.
On speaking, a cough is being induced, so he's unable to hold a long conversation without him having these cough spasms. Yeah.
Dr. Fatima prescribes steroids and pain relief, but the burden of care falls primarily on his loved ones, who serve as the fill-in physician and the 24-hour nurse. And it isn't easy. We could see them struggling with the oxygen concentrator.
Yeah, we couldn't figure out that. We're the champion, right? We're going to win. Just keep positive.
After 30 minutes or so, Mr. Saluji climbed onto his bed, his body aching with exhaustion.
You've had a tough time, haven't you?
God is testing us.
You've got a good team here.
Excellent.
Yeah.
Dr. Lambert and Dr. Lambert had one more house call to make, donning their PPE in the patient's driveway. Inside, we found Hawa Bibi Garwood resting in the master bedroom.
How are you feeling?
I'm feeling
She suffers from chronic conditions like diabetes and high blood pressure. But to the doctor's surprise, she seemed to be recovering from COVID-19.
It's 94. Breathe in and out, right? The first time we saw her oxygen levels were sitting in the 60s, 63.
Okay.
And now we're seeing it at 93.
Okay.
So it's a huge, huge improvement.
The doctors and their machines are important, but Mrs. Garwood says her daughter, Sophia, has kept her alive.
She looks after me very nicely.
Yeah, okay.
She's, and she even sleeps with me at night. She's also studying, so she's working till late night, and then she comes and sleeps with me.
Oh,
Yeah.
okay. So your daughter is actually sleeping here with you as well?
Yeah, she sleeps here with me.
Okay. Right, she wouldn't be able to do that in hospital?
No, she won't be able to do that in hospital. Now we can breathe.
The stress and fatigue are written on Fatima Lambert's face, but she says she's determined to keep going.
My family is actually complaining because I'm in ICU. I'm also an anaesthetist, so I'm an anaesthetist and intensivist, a mother, a wife, but it's the time when we can give to the community. So we put everything aside and help this, inshallah. Yeah. And then you see, their smiles are our smiles. Yeah. Virtual hug. Okay. Yeah, thank you.
The coronavirus has torn through Lenasia, and Abu Bakr Saeed has not been spared. He ran the Sabari Chisti ambulance service with his father and uncle, but both men have died from COVID-19. Yet the pandemic has strengthened his sense of purpose in a community that's found new ways to survive. John Sparks, Sky News, Johannesburg.